Some guidelines for prioritizing care. The nurse and the patient or client must have a mutual rank and the client's needs in the order of importance. We want to prioritize based on high, intermediate, and low. You have non-emergency and non-life-threatening client needs, our intermediate priorities. And when prioritizing care, the nurse must consider time constraints and available resources. When it comes to CPR, if necessary, you want to use the order of CAB. CPR, CAB. Compressions, airway, breathing. This is the exception to using the ABCs when determining priority. When it comes to disaster planning, emergency response, and triaging, emergency response are based on tagging. So we have red tags, we have yellow, we have green, and we have black, okay? A red tag is emergent. Okay, this classification is assigned to clients who have life-threatening injuries and immediate attention is needed and continuous evaluation. But they have the high probability for survival. That is the determination. High probability of survival when they're stable. These would include your trauma victims, chest pain, severe respiratory distress or cardiac arrest, limb amputations, neurological deficits, chemical splashes to the eyes. Your yellow tags are your what we call urgent care. Your yellow tags, this classification is assigned to clients who require treatment and whose injuries have complications that are not life-threatening, and provided that they are treated within about 30 minutes to 2 hours. These clients require continuous evaluation, and this would include large wounds, this would include an open fracture with a distal pulse, those are our yellow clients. Non-urgent clients are your green tags. The classification that's assigned to these clients with local injuries who do not have immediate complications and who can wait at least 2 hours for medical treatment. These clients require an evaluation every 1 to 2 hours after. So we call these people the walking wounded. Now your black tag clients, are victims who are what we call dead on arrival, or they will be deceased because of their injuries being too severe. So for example, if you have somebody who has 60% of their body burned. That's over half of their body is burned. They would be considered a black tag. Someone with fixed and dilated pupils, they would be considered a black tag as well. Okay. Let's move forward into some physiology as it relates to fluid and electrolytes. Just a quick A&P overview. The whole objective is for your body to maintain homeostasis. There are certain processes that need to happen in your body in order for that to occur. So we have deficits, fluid volume deficits, and fluid volume deficit can have an impact on each system of your body. So if we look at fluid volume deficit, by definition, fluid volume deficit is dehydration that occurs when fluid intake of the body is not sufficient to meet the fluid needs of the body. And our goal of treatment is to restore fluid volume, replace electrolytes, and eliminate the cause of the fluid volume deficit. And in order for us to do that, to intervene with that, we need to be able to monitor their cardiac status, their respiratory status, GI, renal, neuromuscular, and provide fluid compartment volumes to normal ranges. So we can provide oral rehydration therapy, IV fluid replacement if the dehydration is that severe. And it all depends on what type of fluid deficit you may have. So if you have a isotonic dehydration is treated with isotonic fluid solutions. Hypertonic dehydration is treated with hypotonic fluid solutions, and hypotonic dehydration is treated with hypertonic fluid solutions. So a couple of things that happens with fluid volume deficit in the cardiac system, you'll have a thready pulse, increased thready pulse. You'll also have diminished peripheral pulses. And decrease CVP, or what we call central venous pressure. And dysrhythmias, which makes sense because your pulse is increased. You'll also have a drop in blood pressure. As it relates to your respiratory status, you can expect an increase respiratory rate. You can expect a decrease in central nervous system activity, so they can go from lethargy to coma. Decrease urinary output. Dry skin, poor turgor, dry mouth, things like that. Its counterpart, fluid volume excess. And fluid volume excess, by definition, we're talking about fluid intake or fluid retention that exceeds the fluid needs of the body. So with fluid volume excess, this is also called hydration, overhydration, or fluid overload. You can expect a bounding pulse, elevated blood pressure, increased respiratory rate, moist crackles on auscultation, altered level of consciousness, increased motility in the GI tract, possibly some diarrhea, things of that nature. You also want to be mindful of the electrolytes as it plays a role in being high or low. Now, this is all going back to what I just said before when it comes to maintaining homeostasis. When your lab values are out of order, when your electrolytes are out of order, these are the complications that can come with it. So let's talk about potassium. That's a very favorable subject. Hypokalemia. That's when your potassium level is lower than 3.5. Potassium deficit is life-threatening because every body system is affected. So when you have a person that has a low potassium, you can expect for them to have a 30-week irregular pulse. You can expect them to have ineffective respirations, anxiety, a decrease in motility, one thing to remember for RN, potassium is never IV push. So interventions, we want to monitor cardiovascular, respiratory, neuromuscular, GI, and renal status, and place the client on a cardiac monitor. And we want to replace the potassium. Hyperkalemia. In hyperkalemia, you're going to have a slow, weak, irregular heart rate. You're also going to have muscle twitching, diarrhea. And in the early stage of hyperkalemia, the muscle twitching is apparent. But if it's a later stage, it's more so of a weakness or paralysis as well. We want to be mindful of when it comes to parenteral nutrition. Our biggest thing we want to be mindful of would be complications. So, for example, if you're administering fat emulsions like lipids, things like that, you want to follow the agency policy regarding the filter size that should be used for one. But you also want to infuse solution at the flow rate prescribed and monitor the patient for any type of adverse reactions. When it comes to TPN, you want to make sure that you are taking blood sugars. You want to monitor the blood sugar. With any type of parenteral nutrition, complications that are seen, air embolism. Hyperglycemia, hypervolemia, hypoglycemia, infection, pneumothorax. These are complications in parenteral nutrition. In intravenous therapy, some complications to be aware of: infiltration, and phlebitis. You can also be concerned with air embolism, catheter embolism, and circulatory overload. Tissue damage is also a complication. Tissues that are most commonly damaged will be the skin, the veins, subacute tissue, extravasation, It's a form of tissue damage. It's caused by the seepage of a vesicant or an irritant solution in the tissues. And that is an emergency. It requires immediate healthcare provider notification so that treatment can be prescribed, and that will prevent tissue necrosis. All right. Blood product administration. The different types of blood components: packed red blood cells. You can have platelet infusions, fresh frozen plasma, cryoprecipitates, and granulocytes as well. You have different types of blood donations. Autologous blood donation, that is a donation of the client's own blood before a scheduled procedure. And what that does, it reduces the risk of disease transmission and potential transfusion complications when you have your own blood. Blood compatibility is important. Remember that blood type O is the universal donor. And type AB is the universal recipient. All right. When it comes to physical examination, your assessment includes inspection, palpation, percussion, and auscultation. Body system assessment is based on objective and subjective data. Objective data is what you can see, what you observe. And subjective data is what they say, what the patient says. These components are important. And this will help you when you answer your questions as well. If a question asks you, what objective data would the nurse deem to be a part of this diagnosis, then you know you're going to select an answer based on what you would be able to see, not on what the patient says. So just make sure you key into those words. That's another word that you can key into.